Good morning. I hope you are good. And for today, I'll be discussing the posterior neck triangle. And as usual, my name is Wallace Chegemoniri, and I'm the Daktari. So let's have a view of the neck. So this here is the neck. So the neck is divided into a quadrilateral uh, space. So this is the side of the neck, which is divided as a quadrilateral space with okay, let me just see. So we have that line there, which uh, which runs from the margin of the mandible, the lower margin of the mandible, to the mastoid process. So the second one is the mid line of the neck. The third one is the clavicle at that point, and the fourth one is actually that line there, which corresponds to the anterior border of trapezius. So that those are the four boundaries of the side of the neck. Okay, then this side of the neck is divided by that line there, which corresponds to the sternocleidomastoid muscle. Okay, so what I need to know is that now this is the anterior triangle. So the anterior triangle, the boundaries will be the lower margin of the mandible and an imaginary line which runs from the angle of the mandible, which will be somewhere near here to the mastoid process, and then that's the superior boundary. Then the anterior boundary will be the mid line of the neck, and the posterior boundary will be the sternocleidomastoid muscles. Then for the posterior triangle here, which will be the focus for today, will be the sternocleidomastoid anteriorly, trapezius posteriorly, and the clavicle forming our base. So what will be the objectives? So by the end of this session, you should be able to state the boundaries. Let me take a pointer. You should be able to state the boundaries in the subdivision posterior neck triangle. Also state the contents of the posterior neck triangle. Also state the attachments, innervation, and clinical significance of sternocleidomastoid muscle. And lastly, we discuss the subclavian arterial system. So what are the boundaries of the posterior triangle? So anteriorly, we have the posterior border of the sternocleidomastoid muscle. I'll be showing you that. Then posteriorly, you have the anterior border of trapezius muscle. Inferiorly of the base, we have the superior aspect of the middle third of the clavicle. The apex is formed actually by the meeting point between the anterior and the posterior border, so which actually meets at the superior nuchal line on the occipital bone. The floor is formed by the investing layer of the deep cervical fascia, which actually extends. In fact, this should be the roof. Sorry, this should be the roof. Sorry for that. This should be the roof. So the roof is formed by the investing layer of deep cervical fascia, which stretches between sternocleidomastoid and trapezius muscle. Sorry for that. And the floor. So I made you should interchange these two. So the floor is actually formed by the prevertebral fascia. It is actually formed by the prevertebral fascia, which actually covers these muscles from superior to inferior. You have semispinalis capitis, spinous capitis, levator scapulae, scalenus medius, and occasionally you might find the fast digitation of serratus anterior. So please remember this is okay. This this should be the floor. Should be the floor, and that is your roof. So sorry for that. Sorry for that confusion. It should be the roof. Right. So this is the triangle itself here, and so this is the sternocleidomastoid there, and the posterior border of that muscle forms the anterior border of the posterior triangle. Then this is the anterior border of trapezius, which forms the posterior boundary of the triangle, and the base there will be formed by the middle third of the clavicle, the superior aspect. Okay. Then here you can see this is actually the investing layer of the deep cervical fascia, and you can see that it is being pierced by some structure. So the roof, this actually forms the roof, and the roof is pierced by some structures. And you can see clearly here, this is the external jugular vein. So the external jugular vein pierces the roof. Also, you have these cutaneous branches of the cervical plexus. There you have the occipital nerve. There you have the great auricular nerve, and there you have the transverse cervical nerve, and these nerves here are the supraclavicular. So those structures actually pierce the roof or the roof of the posterior triangle. Okay, so the posterior triangle, where this is a transverse section of the neck at the level of the sixth cervical vertebra. So where do you find the triangle? So there you have your sternocleidomastoid muscle, and there you have your trapezius. So this is the anterior border, this is the posterior border. So it is here. So what forms the roof? That. So that is the roof, the investing layer of the deep cervical fascia. What forms the floor? That. And that is the prevertebral fascia. So the prevertebral fascia actually is the one which covers the muscles forming the floor of the triangle. And that there is the scalenus anterior, the anterior scalene, followed by the scalenus medius, and finally the scalenus posterior. And then what is between scalenus anterior and scalenus medius? There you have the neurovascular bundle. Okay, so at that point, that is where you'd find the trunks or the roots of the brachial plexus and the subclavian artery. So that's the interscalene triangle at that point. So just to show you the floor, you can see we have the up here. You might find actually semispinalis capitis, then splenius capitis, then levator scapulae, and then scalenus medius and scalenus anterior, and occasionally the first digitation of serratus anterior might be visible. So what are the subdivisions? So this triangle is divided into two by that muscle there. So the muscle there, okay, let me just try to. So the muscle there, that one, that is the inferior belly of omohyoid muscle. So that the inferior belly of omohyoid divides the triangle into an occipital triangle up here and a subclavian triangle down here. So occipital triangle because up here you find the occipital artery, which is a branch of the external carotid artery, and down here you find the subclavian artery, which on the right comes from the brachiocephalic trunk, and on the left is a direct branch from the arch of the aorta. So this is the subclavian triangle, which has another name, supraclavicular triangle, because it is just above the clavicle, and can also be known as the omoclavicular triangle because it is bounded by the inferior belly of omohyoid and the clavicle, so omoclavicular triangle. Okay, so those are the two subdivisions of the posterior triangle. Okay, and then we have some content. So in fact, here you can clearly see the inferior belly of omohyoid, which originates from the suprascapular notch together with the transverse scapular ligament, and that's the inferior belly, and then it makes this is the intermediate tendon. Intermediate tendon will be here, then the superior belly, which is attached to the hyoid bone. This is the hyoid bone there. So this here is the sternocleidomastoid muscle. That it has been cut and reflected. So these are the contents in the posterior triangle. So in the posterior triangle, you can actually see let me start with this. These actually are the trunks of the brachial plexus. So these are the trunks of the brachial plexus. Once you see those the trunks, you identify the muscle anterior to those trunks. That becomes your scalenus anterior. Then on the surface of serratus anterior, you see a nerve running downwards. That nerve is none other than the phrenic nerve, root values C3, 4, and 5. Okay, and then the muscle behind the trunks, that one there is your uh, scalenus medius, the middle scalene, and the one behind the middle scalene is your scalenus posterior, and then that there would be the levator scapulae, and then you identify this nerve which is coming from the trunks of the brachial plexus, heading towards the uh, the levator scapulae. That is your dorsoscapular nerve. Okay, dorsoscapular nerve. And then we also have this here is the cervical plexus. So this is the cervical plexus. We discussed the cervical plexus, and you can see actually here you have your ansa cervicalis. So this is the superior root, which is also known as the descends hypoglossy, from the sense that it contains C1 fibers, and those C1 fibers actually hitchhike using hypoglossal nerve. Hypoglossal nerve is that nerve there. So these C1 fibers hitchhiked through hypoglossal nerve, and then they give you that the superior root, and then the inferior root actually comes from the C2 and C3 segments. So this ansa cervicalis gives motor branches to all strap muscles, okay, to all strap muscles apart from this muscle here, which is known as the thyrohyoid. Thyrohyoid actually is innervated by C1 fibers, which come directly from the hypoglossal nerve. But remember, these C1 fibers are actually not part of the hypoglossal nerve. They just hiked. They just took a ride using hypoglossal nerve to get to the muscle, the thyrohyoid. Okay, thyrohyoid. Okay. Then actually this one here is the subclavian vein. So subclavian vein usually pass anterior to scalenus anterior, and back there, this one here is the subclavian artery, which passes behind or posterior to scalenus anterior muscle. Okay, so yeah, those are the contents, and this nerve actually here, this one, you can see uh, it is on the deep aspect or the undersurface of sternocleidomastoid, and you can see it proceeding towards trapezius. That's the spinal accessory nerve. Okay, that's the spinal accessory nerve. Okay. So those are some contents in the posterior triangle. So what is this abs point? So those cutaneous branches from the cervical plexus, they usually pierce the investing layer of the the investing layer of the deep cervical fascia, and also the superficial fascia at a point. So at that point, you can see there is a point from which all these nerves are piercing. They usually pierce the superficial fascia and the investing layer of the deep cervical fascia at that point, so that they become cutaneous, and from that point they radiate from all into all directions. Like that is the res occipital, that's the great auricular, that's the transverse cervical, and that's your supraclavicular. So that point from which all these nerves uh, uh, pierce the fascia to become cutaneous and radiate in all directions, that's the EBS point, and that is the point you want to perform a cervical nerve block. So if you want to perform some surgeries, and that is the point you apply the local anesthesia. So you that's the point you anesthetize. Okay. So that's the abs point. It is, you can see it is at the posterior border of sternocleidomastoid muscle. So at the posterior border of sternocleidomastoid muscle, that is where the midpoint is actually the midpoint of the posterior border of this muscle. Okay, so this is the cervical plexus. You can see it is formed by the first four cervical, uh, the ventral rami of the first four cervical spinal nerves, C1, C2, C3, C4. So here you can see the C1 fibers giving the superior root of the ansa cervicalis. These C1 fibers actually hitchhike using hypoglossal nerve, then gives you that the superior root. So that is known as the descent hypoglossy there. And then you can see C2 and C3 give you the inferior root. That's the descent cervicalis. And this ansa cervicalis gives motor branches to all strap muscles apart from thyroid. Okay. And then you can see the cutaneous branches. Here you have the res occipital coming from C2. Then you have the great auricular coming from C2 and C3. And then you have the transverse cervical coming from C2 and C3 also. And then you have the supraclavicular, which comes from C3 and C4. And then here you can see phrenic coming from C3, C4, and also C5. But C4 is the main contribution. Okay, so these fibers from C5 actually they might not directly come from the ventral rami directly. Actually, these fibers at times usually enter the superior trunk of the brachioplexus. Remember, brachioplexus starts at C5 all the way to T1. They can enter the superior trunk of the brachioplexus, and then from the superior trunk, they enter the nerve to subclavius, and then they exit the nerve to subclavius and join phrenic. So if they take that variant course, the nerve is that variant course is what is known as the accessory phrenic nerve. Okay, accessory phrenic nerve. Okay, so this is the subclavian artery. So this, in this case, this is the right subclavian artery. So where did the right subclavian artery come from? It came from that. That is your brachiocephalic trunk. And then this brachiocephalic trunk divides to give you the subclavian artery, the right subclavian artery, and the right common carotid. So you can see the right common carotid at this level, the fourth at the C4 cervical vertebra level, it divides into an internal jugular and an external jugular. Okay, so the internal carotid and an external carotid artery. Sorry for that. And then this subclavian artery is divided into three parts by that muscle there, and that muscle is none other than your uh, your scalenus anterior muscle. Okay, so it is divided into a first part which is medial to the muscle, a second part which is behind the muscle, and a third part which is lateral to the muscle. But remember, subclavian artery continues as the auxiliary artery at the outer border of the first rib. So somewhere here, this is the first rib. So somewhere there, that point, it now becomes the auxiliary artery. Okay, so those three parts have branches. So the first part, which is also known as the pre-scalene part, pre-scalene, it is before scalene, scalenus anterior. So first part has that branch, which is the first branch of the subclavian artery, and that is none other than the vertebral artery. And then that one there is your thyrocervical trunk, and from the thyrocervical trunk, you get one the suprascapular artery, the transverse cervical artery, and the inferior thyroid artery. And then from the inferior thyroid artery, it gives off an ascending cervical artery. Okay, so ascending cervical artery ideally comes from the inferior thyroid artery. And then you also have the internal mammary or the internal thoracic artery, which comes off the first part. So the second part only gives you the costal cervical trunk. So the costal cervical trunk gives you the supreme intercostal artery, which is also known as the superior intercostal artery, and also gives you the deep cervical artery. So the other name of transverse cervical artery is actually superficial cervical artery. So superficial comes from the first part, the deep cervical comes from the costal cervical trunk, which comes from the second part. So that part only gives you one branch, and that branch is that. So you can see that branch coming from that part, and that is your dorsoscapular artery, which goes to participate in the scapular anastomosis, and so it anastomosis with the suprascapular artery and the uh, circumflex scapular artery. So remember, circumflex scapular artery came from your subscapular artery from the third part of axillary artery. So that anastomosis is key. I urge you to remember that anastomosis. And with that, guys, let's discuss this subclavian stage syndrome as the last objective. So this subclavian stage syndrome occurs when we have a prevertebral subclavian artery stenosis. So imagine your left subclavian artery is occluded, is stenosed, is narrowed prior to the uh, before it gives off the vertebral artery. So that is the prevertebral subclavian artery stenosis. So blood will actually reach the left upper limb, but it will take an interesting course. So it will enter the brachiocephalic trunk into the right vertebral artery, but instead of moving to the sac of Willis, because the two vertebral arteries actually join at the pontomedullary junction to give you the basilar artery. At that point, blood will actually flow down on the on the on the on the on the opposite vertebral artery because of gravity. Okay, so there'll be no blood flowing upwards in this vessel here. So because of gravity and reduced resistance, blood will actually, instead of continuing to the sac of Willis, its flow will be reversed and it will flow down and go to that upper limb there. So that's the subclavian still syndrome. So how will the patient present? One, there will be limb claudication. So when that limb is exercised, there will be pain, uh, uh, and the skin will tend to be pale. That and so that pain is the limb claudication. Okay, but also there'll be vertebrobasilar insufficiency. So, and remember, the vertebrobasilar system is actually what gives you the posterior cerebral arteries, which actually supply part of the visual cortex. So there'll be some visual disturbances such as diplopia. Okay, there'll be diplopia. Also, the vertebrobasilar system is actually what uh, um, supplies the brainstem, majority of the brainstem. So because of that, there'll be decreased consciousness because the reticular formation is actually what maintains your consciousness. So there'll be uh, uh, dizziness at first, then a coma if in severe cases. Okay, so that's the subclavian still syndrome, and I believe that marks the end of that interesting session. So, guys, I would like to acknowledge Gloria and Natalia for that photo of the neck. That was a photo, and thank you once again. And please do subscribe for more of med content. Thank you.